Whether you are an active athlete or maybe just a little bit clumsy, pretty much all of us have stubbed a toe or rolled an ankle at some point. However, occasionally foot and ankle injuries can become more serious. And that's when you call Dr. Matthew Pacana from Coastal Orthopedics. He is a foot and ankle specialist. Great to meet you.
You too. It's good to meet you.
So tell us what makes ankle sprains both so common and so hard to manage.
Well, one of the main reasons it's so common is most of the time it's just a little bit of bad luck. You know, the most common groups that we see this happen to are usually our athletes and then also our elderly and aging population, which is obviously in the Florida area, something that we see commonly with the snowbirds coming down.
Right. And one thing I know that me and anyone older than me is going to ask, is there anything I can do to keep that part of my body strengthened and strong to try to avoid spraining an ankle?
Absolutely. I mean, I think the biggest things are making sure you're staying in good physical health. One of the big things is bone health, which is a very hot topic in the world of orthopedics right now. Making sure that you have a good vitamin D intake and a good healthy diet, as well as really the core strengthening. So staying fit, not just in the lower extremities, but in the upper and core as well. Making sure you're getting workouts in, several times per week, or even just walking for exercise to keep everything strong.
Because unfortunately, accidents are going to happen. I mean, I think we all know that you miss a step, you twist an ankle.
For sure.
Whether you're an athlete or not, that happens.
Absolutely.
When we do something that involves our feet or our ankles, what should we do at home as our first course of treatment?
Yeah, absolutely. So first thing is, want to make sure that you're getting off of it, not putting a lot of weight on it. If that means going home from work, sometimes you got to do that, and so people walk on it all day and things will get worse. Ice it, elevate it, some ibuprofen, some sort of anti-inflammatory, and then give us a call at Coastal.
So I call myself Dr. Mom because I have a lot of athletes at home and I'm always yelling, rice. That's what we do when we get hurt, rice. Is that really true? The rest ice, is compression still a thing?
That is definitely helpful in the beginning. As things progress, that becomes a little bit less helpful once you're being treated for it.
Okay.
But early on, the rest and the ice is very, very helpful to keep the swelling down, which decreases the pain, but also helps things heal.
Okay, so if we do all these things at home and then we're still not getting better, that of course I'm sure is when we give you a call.
That's right.
What type of things, whether it's a foot or an ankle injury, are you looking at to see if it's something that'll just heal over time, or whether you may be able to speed up the process?
Sure. I mean, it comes down to two things, really, when I examine them and how the ligaments and the other structures feel, and then the x-rays that we take in the office. So any new patient's going to get some x-rays, just kind of ruling out things like fractures and that sort of thing. But ultimately, if there's no fractures, generally speaking, we're talking about a sprain of some nature, whether it's ankle or foot. And then from there, the treatment kind of depends on which of those things we're dealing with.
I understand that you do something that's I had not heard of before called ankle replacement.
Yes.
What would have someone need that? Is that just a really bad break, or is that the wear and tear over years? So
that's the wear and tear over years typically. And so someone that maybe had a lot of ankle sprains in their life will develop arthritis in the ankle, which we call post-traumatic arthritis. Or if they had a really bad fracture in the past, they might develop arthritis in the ankle. And in those situations, we used to fuse the ankle, which can be somewhat limiting in terms of motion. It can change your gait somewhat and make people feel uncomfortable, even though the pain is gone after an ankle fusion. Ankle replacement allows us to maintain motion in the same way that a knee replacement would help maintain motion when you're getting stiff. And so it's a newer developing option that we have to keep people mobile as they age and also relieve the pain they have from the arthritis.
And honestly, it sounds kind of exciting because, I mean, we know about the success of knee and hip replacements. Our ankles support our entire body.
They do.
So, I mean, if you're in pain, that can really impact your quality of life.
Absolutely. I mean, ankle replacement is definitely newer than hip and knee replacements, but at the same time, they're getting better and better, and they're lasting longer, similar to hip and knee replacements, and so they're a really great option for folks with those problems.
Well, I know you treat everything from a minor sprain to major reconstructive surgeries. So welcome to the Suncoast.
Thank you.
We love that you are here, and it's great to know that we're able to get some help for both our aging issues and our athletic issues.
Absolutely.
To find Dr. Pacana, you can go to coastalorthopedics.com. We'll be right back.